Depression: An Analysis of the United States of America, Australia, and China by Rachel Buczynski. In this presentation, we'll be comparing the global prevalence of depression between these three different countries. When we look at health statistics, we can see that globally life expectancy is 73 years of age. All three of our countries that we'll be looking at have exceeded this, yet have a lower average and infant mortality rate. There is a trend, however, which is the depression-related deaths. What is depression? It's a common mental illness, a mood disorder that can be short-term, long-term, or reoccurring. If it's reoccurring, it can be considered a chronic disease and can lead to serious health conditions such as death by suicide. 3.8% of the world population is affected by depression, and this includes all genders and age groups, all income groups. And while disparities may exist, it is still a global issue. Treatment is specialized through hospital, inpatient, outpatient, and intensive outpatient. Community health services have proven to be extremely helpful, and traditional treatment is psychological therapy and medication management. Healthcare systems have a major effect on access for the community. We're going to look at the Quad model, which emphasizes financing, insurance, delivery, and payment in order to compare these three countries, their healthcare systems, and access. The United States is a fee-for-service system. Financing is limited through the government, and the majority of it is run through a private sector. This causes high costs and low access. Many obstacles exist. There's high community support in the United States and low social stigma and emergency resources. This leads to 35% of diagnosed individuals getting treatment, surprisingly higher than many other places. In Australia, we have a Medicare system. Financing is paid for by the government, and primary health networks equal coordinated care. Research is also funded by the government, and statistics are delivered straight to them. Depression in Australia has gone through a major reform in treatment processes. This is due to the government involvement. They've been investing research and care increased to $9.4 billion. They're focusing on reduction in harm and long-term solutions. China has basic medical insurance. Medical aid ensures basic medical security and government funding. However, due to the high stigma, there is low access to care. Basic insurance will cover all basic hospital costs. Depression in China has a treatment rate of only 1%. Traditional Chinese medicine is preferred like acupuncture, and it's highly stigmatized, which leads to low percentage of people seeking treatment. World suicide rates you can see here are on a downward slope. However, in our two high-income countries that are considered developed, we see that that is not the case, as it is an upward slope. We look at economic status, we can see that the United States and Australia are above China, that there is a high amount of people living in poverty, and the gross domestic product is not in comparison when looking at all three. Healthcare spending is the same. The United States spends an excess amount of money. However, their government expenditure continues to be low, and out-of-pocket costs continue to skyrocket. Disparities exist in low income and low education. Those reported to have multiple races are at increased risk, as well as women and adolescents. There's great prevalence between the ages of 18 and 25. We can see through this schematic that females are more affected by males. However, we can see that the gap in those disparities is much larger in the United States versus Australia and China. Next, we must reduce the stigma, increase community health resources, and invest in research to develop additional treatment options. We can see in the United States strong community sources, and in Australia's strong research funding and government involvement lead to success. In conclusion, we can see that our treatment rates will increase when we have high government funding, government involvement, coordinated care, and community resources. Reducing the stigma is a great aspect. Regardless to how the community responds to the prevalence of a disease, the government response is much more important. The funding focus is what's going to give us access to new treatments and put an end to that increase in prevalence. Thank you.